To the presenters, and we'll begin with the first presenter, Dr. Vishaal BHAMBHWANI, who would be talking on simulation-based ophthalmology education for medical students in Canada, a pilot project. Over to you.
Thank you. Good morning, everyone. I'll be presenting our paper on the use of simulation-based ophthalmology education for medical students in Canada. Thank you. These are my financial disclosures. So the International Council of Ophthalmology recommends a certain minimum standard for ophthalmology exposure during medical school. However, despite this, ophthalmology is an underrepresented specialty in many medical school curriculums, and literature shows that this leads to lack of confidence in medical students and clinicians when dealing with eye conditions, and the standard of primary ocular care can be made better if more effective undergraduate ophthalmology teaching could be practiced. So what is simulation-based education? So simulation is a method of instruction which involves creating a realistic scenario which mimics real-world situations, and this allows students to practice skills in a safe environment and without risk to the patient. Now, there is a lot of literature on the use of simulation-based education in medical training, but very limited literature regarding its use for ophthalmology education. A lot of these simulation-based education exercises involve simulators which are very expensive. So our study actually aims to evaluate use of low-cost simulation-based education methods in ophthalmology training for medical students to increase their knowledge, interests, and skills in ophthalmology. So this was a prospective study which was conducted at the Northern Ontario School of Medicine University in Thunder Bay, Ontario, Canada. A second-year NOSM-U medical students participated in a 2-day workshop which involved simulation-based ophthalmology training by an ophthalmologist and a simulation educator. The initial information was presented to students in the form of a PowerPoint. And then we used standardized patients, eye models, and simulator models to impart education on clinical and procedural ophthalmology skills, which included vision assessments, slit lamp examinations, ophthalmoscopy, retinoscopy, ocular motility assessments, laser procedures, and steps of cataract and strabismus surgery. So the figure A is an eye model which is used to practice steps of cataract surgery. B is an eye model to practice steps of strabismus surgery. C is one of the American Academy of Ophthalmology simulators which is used to assess ocular motility and strabismus assessments. And D is shows simulator models which are used to practice ophthalmology laser procedures. This is again one of the models that is used to practice cataract surgery. Now, we used questionnaires to evaluate learners' ophthalmology experience, interest, and knowledge before and after the workshop. And we also gave them a feedback survey to assess the quality and usefulness of the workshop. So 9 students participated in the workshops, and we found that compared to pre-workshop, immediately post-workshop, we found that there was a statistically significant increase in learner confidence, interest, and knowledge. And a lot of these were maintained even 3 months after the workshop. Regarding the feedback questionnaire, the usefulness and the effectiveness of the workshop was rated very high. And the overall educational value of the workshop was rated to be 4.9 out of 5. So most of the students felt that the workshop was very relevant, comprehensive, easy to understand, and they gained knowledge and skills which they could apply to their future clinical practice. And they also recommended that such activities should be included in the medical school curriculum. So our study shows that even using a low-cost simulation-based training exercise can improve medical student knowledge, skills, confidence, and interest in ophthalmology. And this could be done in a learning environment that students find comfortable and enjoyable. These are our references. Thank you.
Yeah, so we open it up for discussion. Nice presentation.
Thank you.
So if there are none, let me begin that across the training models, like you had a kind of a significance over those 9 students, right from the baseline to the first one, and then it progressed again. So in the last one also there should be significance if you consider from the baseline, right? Or was it from the...
Yes, yes. So we did the questionnaires, and the survey was done at baseline and immediately after the workshop, and then 3 months after the workshop. So there was statistical significance at all the intervals, but we found that the scores for ophthalmology knowledge, for example, were higher immediately post workshop compared to 3 months after. But compared to baseline, it was still significant. Any other questions?
If not,
Thank you.
thank
Thanks.
you for the nice